Hey folks, it's Patriot Nurse. Thanks so much for joining me today. In this video, we're going to be discussing the major changes that have happened in the healthcare industry in the United States over the past 2 years and why it is that you need to be preparing yourself for being your own doctor. So friends, ever since COVID, there have been a series of massive changes in the healthcare and the medical industrial complex in the United States. This change has taken many faces to it. One of them is labor, the other is supplies, the other is protocol. So I want to go over that with you because I think it's really critical that over the next few years, you wrap your head around this and understand that the good old days of somebody that actually cares about you, that holds a medical degree and like showing up at the hospital and everything's okay, those days are gone. That's not to say that there are not good people who work in healthcare who are still actively employed in healthcare and that you can still get good care in places. But the standard level of care in the United States has been dropping linearly for the past several decades, but it took an inverse J-curve drop with COVID. And you need to be aware of this, and you need to be able to position yourselves and your family to ride it out, essentially. Labor, supplies, and protocol. The workforce in nursing, in particular, which is my background, has been aging over the past several decades in the United States. Many nurses were aging out or nearing retirement or just frankly so burnt out that they were considering a career change prior to COVID. What happened with COVID was that it accelerated the decision-making process that many people were inevitably going to engage in, but also it showed many nurses and healthcare providers and people involved in this industry, it showed them a clearer path to the inconsistencies that this industry has with their own conscience and values and moral standing. When you have an industry that incestuously allied itself with the federal government in a very fascistic kind of bed partner setup, which is what happened with COVID, you had corporations, hospital entities, large, powerful people put down requirements upon healthcare providers that they take experimental drugs, that they had no body autonomy in working there, and that they were either forced to leave, they were fired, they were physically removed from the premises, or they either capitulated in taking experimental drugs. And because of this, many good nurses, many doctors, many healthcare providers left. They're just like, nope, I'm not dealing with this. So what this created, and I've seen this with my own family over the past year with being in and out of the hospital for various different things, what this created was a gulf in leadership, a gulf in compassion, a gulf in empathy, a gulf and a lack of critical analysis and critical thought within the healthcare providers who comprise the United States healthcare system's workup, the labor force. This creates, by default, a major departure in previously assumed standards of care. Fancy term for all of this. When you show up at the hospital nowadays, or you go to a doctor's office nowadays, you cannot bank on having somebody who's going to be emotionally present for you, giving you health care. You cannot bank on having somebody who's going to be with it enough from a critical analysis and a critical thinking standpoint to suspend judgment on things aside from the party narrative. Meaning that if the alphabet soup organizations tell them something, they're going to believe it because their job's on the line, and they're going to transfer that pressure to you as the patient when they're the healthcare provider. That's what you have to expect. This is not a good setup. And so for this reason, many people who are not healthcare providers and many people who had previously been more involved in this medical industrial complex in the United States, they are self-selecting out of it for darn good reason. Because the labor has functionally changed. The labor force has changed. And the value system of the existing labor pool has drastically shifted. This is more than just post-COVID. This is also a generational thing. You're dealing with people, and I can say this as a healthcare provider working with other healthcare providers in a professional capacity. You are dealing with people who are raised on screens now, who were raised in broken homes. Not to say that that automatically is going to have a negative impact on everybody and anybody. But when you have, for instance, children who were raised on screens, who were raised devoid of appropriate maternal input to develop their empathy skills, Now these same people are providing healthcare for people. So is it any wonder that we have automatons and partial board-like beings with, a pulse and a medical license rendering care in these hospitals? This is what you're dealing with when you go in there. This is very, very harsh criticism, somebody might say, but I'm just telling you straight dope. This is what it is. The labor change is a huge part of it. Now we need to talk about supplies. All of this is leading to, by the way, an eventuality that you need to prepare for, and I'm going to walk you through at the end of this video steps practically to do this. Supplies. So even during COVID, we had disruptions in supply lines, which we were told, whether it was drugs or whether it was pre-prepared IV fluids or whatever, that these were, that there was just hiccups in the system and that eventually it was going to get rebooted. What we've seen over the past 2 years is that this grid of dependency on just-in-time inventory set us up for major pain. And this is continuing because the profit margins are set up to perpetuate themselves on such narrow margins, depending upon outsourcing things overseas to cheaper labor, to cheaper drug manufacturers in India or Puerto Rico or elsewhere, and then having it shipped here to the United States just in time. The supply infrastructure that we are dealing with is much more problematic. Even though we are headed back towards a new normal, this strained the system a lot. And the strain that people are feeling in the hospitals from the supply line, this is not going to get any better. The other point is that supply and demand are but two sides of the same coin. We have an aging population here in the United States who in many cases have not taken care of themselves, who eat absolutely atrociously and who have lifestyles of absolute sloth and laziness. And so when you've got, on one hand, a population that has been abusive to their bodies, with eating poorly, with not getting enough quality exercise, movement, not having appropriate social supports and inputs, this population getting older is going to require a lot more supplies. By the way, supplies that the taxpayers are funding through various welfare programs and socialized medicine. Because of this, supplies are going to be in a shorter availability. They're going to be more expensive when and if you can get them. But also you have to expect that if it's something that many people need, that it's going to take longer to get there for various different reasons. So supplies are a big part of it. And the third is protocol. Having seen this myself with my own family members over this past year, protocols are heavily politicized in the medical world. And you need to understand this as someone who is a consumer of healthcare services. Protocols are designed to keep licenses safe, people safe from being sued. They are not designed exclusively for the patient's best interest. We would like for them to be, but when you have alphabet soup organizations who have incestuous alliances with the federal government, who in many cases are comprised of people who are patent holders or co-patent holders on drugs and healthcare implements and interventions, you can't expect them to have somehow blindness when it comes to their best recommendations. They're going to act in their own best interests. Now, the FDA, in many cases, has suspended conflict of interest barriers due to what they consider subject matter expertise on the part of doctors and people with lots of letters after their name, comprising healthcare regulatory panels. This is definitely true when it comes to psychotropic medications for children recommendations. And if you, by the way, if you need further reinforcement of what I'm saying, there's a really great documentary called Generation RX, and it goes into this, and it's honestly, it's very troubling. As somebody who worked in psych nursing, I can tell you that it's unfortunately a lot more true than what people would think, the degree to which money colors recommendations and protocols. Protocols are going to change on politics, and they're going to change on financial interests. And both of those have shifted. The environment for both of those have shifted drastically over the past 2 years. In my own family, I had a family member who was a patient for a major surgery this past year. And this patient had many different pre-existing conditions, which placed them in a high-risk category. This patient had had a similar procedure done in the past, so there's a good track record here of what was expected. The hospital stay should have been at a minimum 72 hours. They were discharged after 20 hours with inadequate pain medication. They were not given appropriate physical therapy. They were not monitored appropriately, and they were actually the victim of abuse in a hospital setting. Nurses can indeed abuse patients, and unfortunately this happens all the time. Why did all these various different things happen? It happened because of labor shortages. It happened because of supply shortages, and the protocols were changed to give the veneer of good care while still accommodating both of the aforementioned. You're going to be told in times moving forward that you're receiving good care and that protocols say this, even though you know in your gut instincts are that your family should either be staying longer, or be treated with different medications, or be receiving more interventions and more support, but it's just not there. And the reason why it's not there, and the reason why you're going to end up getting subpar care, most likely in a hospital setting, is that there just is not enough to go around. And it's just being cloaked right now. It's being cloaked fairly well, I would say. There's a lot of political impetus, definitely from the people who sit in power right now in Washington, to keep people calm about this, because we have a large percentage of people who are either retired, semi-retired, or about to retire in the United States, and they vote. And so if their health care, which they hold so dearly, that they paid into, that they were told their whole lives, or you're paying for this, or you're paying for some semblance of a good retirement at the semi-sponsored by the federal government. When they start to see that these lies are what they are, and that these promises are not being fulfilled, they're not going to vote for certain parties and certain people. So there's definitely a political impetus to keep this under wraps. What can you do about this? First off, you have to understand, and I'm pleading with you because I've had these conversations with my own family members. Please understand that the good days of empathic and caring healthcare providers, like you could call up a doctor and they're actually going to listen to you, or that's gone. And you need to own that. You have to assume, I'm sorry to say it, but it's the truth. You must assume serial ineptitude when you go into the hospital, borderline maleficence, and potential political weaponization of any healthcare provider that you're dealing with. Why would you say that, Patriot Nurse? Why would you say like political weaponization? Because the people who ended up staying in healthcare over the past 2 years, many of them were sold out to the party narrative, and they do not like non-compliance on the part of people who do not agree with their party narrative. So you're going to have to be very judicious when you speak to people going into a healthcare system, particularly when it comes to, the degree to which you talk about your personal choices and either declining medical advice or the reasons for it. I would say less is more in this case, but I ask you the question, is it really medical advice if declining or selecting a different option results in visits from DCS or visits from other federal entities that are doing welfare checks? No, that's not advice. That's not advice. That's a mandate, and that's a threat. So many people are choosing to go less into this system now. I would recommend that you store up your own medical supplies. I would recommend that you decrease your dependency upon the medical industrial complex as best as possible by making diet and lifestyle changes that would get you off of their medications that many are taking simply because of what they're eating, and honestly keeping toxic situations perpetuated in their own lives, whether it's a toxic work environment, toxic interpersonal relationships, toxic family environments. A lot of people get very, very sick because their body is rebelling against a situation that they refuse to extricate themselves from. So that's hard, and I get that, but for your own sake and peace of mind, choose health and choose peace in your life. Thirdly, you need to educate yourself as best as possible on alternative and traditional methodologies of healing. This includes herbs. This includes various different traditional means of preparing medicines from things that frankly grow in your own backyard and that are in your kitchen cabinet, kitchen spice cabinet. So I can recommend for you that there are several books on my website on the bookshelf portion to get you started. I also teach classes. I'm teaching a medical class that is focused on herbal preparation and theory, and I have 2 spots left, and that is in 3 weeks in Knoxville. That's herbal theory and preparation with Patriot Nurse, mandatory prereq of having my medical prep 101 and 201 class and or the online class. In a few weeks, I'm going to be releasing my 2023 schedule. In the 2023 schedule, I'm going to be teaching medical prep classes to help people function in absence of having healthcare available for them. And also, if the class itself saves you from one trip to the emergency room, it paid for itself. So you might as well come and have a good time and get connected with like-minded people and then save yourself a needless trip to ER, Lord willing. So there's a lot that you can do, but I just want to give you straight dope on what's going on and how things are changing from an environmental standpoint. And hopefully that equipped you and allowed you to make solid choices in your prioritization for 2023. I hope the video was a blessing to y'all. If you enjoyed it, please subscribe to me here on YouTube, Patriot Nurse. You can also support me and stay with me on Patreon, Subscribestar, Cryptocurrency, and PayPal. I got links below. Thank you guys so much for being with me. We surpassed 500,000 subscribers this year. Thank God. All glory to God. I'm astounded and very, very grateful. Thank you to all of you who regularly tune in. Thanks for bearing with me too. I've dealt with a lot of sickness over the past 2 months and was out for a good 6-week stretch there, which is the longest stretch that I have not made a video in 10 years. So, you know, I was not just skating and chilling and relaxing and coasting. I was trying to heal and get my strength back. Still not back 100%. So I appreciate y'all praying for me. Please continue to keep me in your prayers. And many, many blessings for 2023. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.